it was quite interesting to note a whole lot of our doctor friends being a part of this particular academy, right? And we did find out that there were quite a number of professionals who had money, but they didn't know where to invest. Various cities, when we have doctor professionals in this platform across various cities, I would probably be welcoming all these doctors to take this up in each of their own cities and launch this. And that is going to be a fantastic opportunity for us to collaborate.
Hello and welcome to another episode of Hall of Fame interviews. Today we have a very nice couple, Dr. Pradeep Kumar and Dr. Sangita with us, and they have created a very nice facility in Bengaluru. And they will be talking about the journey which they have done in the last few years. And there are a lot of lessons from journey. So welcome, Dr. Pradeep, and congratulations on Hall of Fame.
Thank you so much, Dr. Pranav. It's been a wonderful journey all these years, and to share my experiences on this fantastic platform that you and Amit have started. It's a huge privilege and honor to be a part of this. Thank you so much for this invitation.
Yeah. So 100-bed hospital you planned, almost 60 beds are there, and you're working this hospital very nicely. All the hard work has gone behind, and whatever experience you have gained. Tell us something about your journey of MBBS and post. After that, what place you joined and how did you get the experience from there?
Yeah, it's been an exciting journey, Pranav. When I completed my post-graduation and came out with flying colors, getting awarded as a gold medalist in JJ Medical College, Davangere in the year 1999, I thought life is all hunky-dory. But to face a stark reality, came out, applied to various hospitals in the Bangalore, and they gave me fantastic designations, but not even reaching a 5-figure salary in the year 1999. Right. And I was due to get married in the next 3 months' time. And I was wondering what is life got in store for us. And that's when my professor, I met my professor, Dr. Nagaraj Shetty, and asked him, sir, do we have any other alternatives and options? That's the time he suggested to me that there is this particular peripheral health center, which is adopted by a group of Indo-American philanthropists in Ahmedabad, 80 kilometers away from Ahmedabad, called as Vatrak. Yeah. So this is called as Srimad Fateh Singh Rao Gaikwad General Hospital. So that's the place where we started our career. That was a place, it was a peripheral health center. We were treating OPD patients for 2 rupees. We were admitting patients for 5 rupees per day. We were doing any surgeries for 25 rupees a day. And being in such a remote center, I started treating poisoning patients, snake bite patients, heart attacks with the most basic kind of a setup. And that's what gave me immense confidence. And immediately when I started this, I called in Dr. Sangita immediately after a marriage and asked her to come down and see how is this place, because she's been a daughter of a colonel, been in the best parts of the country, across, traveled to the best places. I wasn't too sure whether she would be open to stay in such a remote kind of a rural kind of a setup. I asked her to come down and see if she likes the place. Fortunately for us, she liked the place. Hospital authorities also gave her a position in the dental department. And we started off our career. Those 2 years were probably the best years of our career. It was a wonderful place to live in. The people were so lovely. We were treated as gods. You can understand the first produce that comes out from their field was reserved for us. We were welcomed as chief guests for any of their home functions. And that's how that journey was so very inspiring. And after a couple of years, when I was about to leave that place, the entire village was at my father's foot. Please do not take him away from this place. Don't mat kijiye. उनको जो चाहिए आप बोलिए, उनको घर चाहिए, मकान चाहिए, हॉस्पिटल चाहिए, प्राइवेट सेटअप चाहिए, सब कुछ बना के देने के लिए हम सब तैयार हैं, मगर ऐसे जो भगवान ने भेजे हुए फरिश्ता को हमसे अलग मत कीजिए. So those were overwhelming kind of a moments for us. My son was already born, so we had to take a decision. I was passionate in teaching, so that's when I decided to come back to Bangalore, which is my hometown, and I joined Vaidai Institute of Medical Sciences as an assistant professor. And that was the first year of the medical college. Though my passion was teaching, I was drawn more into administrative purposes, and I was setting up protocols to set up the Department of Internal Medicine. And that's probably some stint that I got, which gave me some kind of an administrative skills. And that's what I'm trying to utilize in the current day and context that is there right now. A couple of years later, I was kind of stagnating there and not much of growth. That's when we ventured out to do something special. We started off something called as First Consultants, a group practice for a group of physicians. We took over the Department of Internal Medicine in various nearby hospitals. I became a freelancing consultant. We started corporate healthcare called as First Health, which was setting up in-house healthcare clinics, which Dr. Sangita was spearheading the entire unit, setting up multi-diagnostics, a diagnostic center, a physiotherapy, a pharmacy, and multidisciplinary OPD consultations. That was a concept that was there. We set it up in tech parks and tried to make this as a concept where the corporates should come and avail their healthcare benefits instead of individually setting up their in-house clinics. That was too prematurely ahead of times. It did not take at that point of time. So what I would want to convey through this point is timing is everything in our journey of entrepreneurship. Either you are ahead or you're late. I don't think you can make it. So though those concept was extremely good, but we weren't placed right. So the listeners of this audio podcast, video podcast should understand that any product that we have, the product needs to be appropriately placed in terms of timing, appropriately priced in terms of services, and that's when we get success. So that's one point that I wanted to convey in this particular venture, where we did not succeed as much as what we wanted to succeed. Going further ahead in this journey, that's how when we started off this hospital, which was ably supported by my parents and my in-laws. My parents are central government employees with very meager resources. My in-laws, Colonel Hari Prasad, is a civil engineer who's executed massive hospital projects for the army across the country. And that massive experience, along with the enthusiasm that my mother-in-law got in, she got herself equipped with a postgraduate diploma in hospital administration. She wanted to actively contribute for this hospital. And that's how, with very, very meager resources, we dreamt of this massive project of a 100-bed hospital, which I don't think people with our financial capability would probably have dreamt to achieve. But with able support of such family, we were able to execute it. In the year 2010, we started off this 60-bed hospital, which is a multi-specialty hospital. We have completed 14 years in this journey so far, and it has been a gratifying story. So what we want to put across to the audience here during this journey is the mistakes that we made here. The mistakes that we made here is that though we were confident about doing something, we did not have the enough resources that is there. So unless and until you are able to chew what you're able to bite, you need to have the adequate resources that is there. Unless you have them, you may not be able to do the right kind of things. So that kind of took us a little longer time to when we're doing something like this, a multi-specialty, it can't be a one-man show. You need to have people to get into all these things. Dr. Sangita has been the person who's spearheading the entire administrative protocols in the hospital. She's taking care of the entire day-to-day operations, including taking care of finances and other things. So what between the both of us, what we have decided is that I will be responsible for the inflow in the hospital, and Dr. Sangita will be responsible for the outer responsibilities in a very, very structured manner. My father and mother-in-law did support a kind of a retirement from this hospital. They still support us remotely. And currently, we are in a phase where we are looking at expanding our hospital from 60 beds to 100 beds and add on newer specialties like cardiology services, infertility services, cosmetology, and hair transplant. So this has been the journey over the last 15 years, which has had its own share of ups and downs and a lot of learnings that has really helped us to reach this stage, Dr. Pranav.
Then in the Vedi hospital, and after that hospital, you're having your own entrepreneurship. You learned the long way and learned by the own experiences, making mistakes and correcting them. It is very evident from your talk that so much of water has gone, and then you have achieved this. Ma'am, what do you want to say? How has been your journey?
It's been good. It's been exciting. I've learned a lot. Although I don't practice much of dentistry, but I'm happy.
Short and sweet. Great. So you mentioned that stay in the Vatrak, where people are actually giving you the first crop and whatever they have the best. they feel that you should be giving it to the doctor. That is what the image of doctors is in a rural, and that will happen only when you have given 100% without taking money from them, or maybe main service kind. That service has taught you a lot of things. Working in minimal resources and how to make it cost effective. That might have worked in this hospital in setting up and the whole SOPs and checklists that you made. That experience is very important.
Absolutely. It is. I don't think we would have been able to complete this particular project with the kind of resources that we had. Mind you, we were just the four of us who did the entire conceptualization to planning to execution to architecture to procurement to financing to business plan. There was not a single consultant involved in this entire process, Dr. Now, and we were able to cut down the project cost to almost 1/3 of the actual cost. And that was a huge learning and a huge saving that has given us confidence on how we would probably be able to, in spite of whatever adversities that we had, we converted those adversities into opportunities, and then we learned a few things down the line, and that is how we were able to sustain. Being in Bangalore, a city like Bangalore with the big sharks and the corporates who are around, it is not too many successful stories that you could hear,
right.
But God has been fortunate, and we are very, very kind to the Almighty to have supported us throughout this entire journey. And we've been blessed with the right kind of a people, including our families, friends, and which has taken us up to this journey. So that was also a kind of from my childhood. The owner happens to be a person who's seen me from my childhood growth, and he had this particular land. So we had taken this particular land on lease. So we actually came in to set up a kind of a daycare center. It was Dr. Sangita's idea to start off with a daycare dental center. And she said that we just wanted to be on the main road to set up this particular center and put up a posh clinic. We came with that idea in mind, and we landed up taking the entire 50,000 square feet of the 5 feet space.
Yeah.
Because we said, okay, now you have a daycare kind of a thing. Then what would happen if a patient comes in an emergency? What would happen if a person requires an ICU? What would happen if a person requires a surgery? What would happen if a person requires other things? So we kind of built upon one after the other. And on the same day, we decided, no, we want to go ahead and do not just a daycare center. We want to do something like a multi-specialty hospital, and this 100-bed hospital was there in our mindset right from the beginning. And friends and in-laws and said that this is what we are planning to do. They kind of scanned me from head to toe and said, are you all in your senses, or do you think that you're doing some kind of a daydreaming? Then he said, Doc, Pradeep, I think let's do it. You have some kind of a vision. Let's go ahead and do it. We'll put our 100% efforts. And that's how they jumped onto the bandwagon. They gave in all the support that they could in whatever ways and fashion, and we were able to successfully set this up in the year 2010.
Okay. So when did you join the academy?
I joined the academy almost 8 to 9 months ago, Dr. Pranav. That was a time that I was getting exposed to this, and I was happy to see you being on the forefront, being a plastic surgeon, and then Amit being there on the financial front, and both of you kind of giving wings to people's dreams and other things. That's what inspired me to be a part of this particular journey. I've not been very active on the platform, but I'm wishing and hoping to contribute better in the days ahead.
So what all you have seen in that academy, like videos and meetings? What you are actually utilizing?
I've been a part of all the regular meetings that are there.
Yeah.
One thing that I actually wanted to imbibe into was the AI influence of AI in healthcare, and that's
Right.
why I joined the special program to be a part of this particular program. I'm
Right.
yet to go through the entire curriculum, and I'm sure there are a lot of things that are going on in my mind. One of the other reasons I did mention to you once, I'm not too sure about our journey related to Beast. So this is another story that I wanted to share with the audience here on how we conceptualize this particular project called as Beast. Do you think it's the right time for us to?
Please.
Yeah. So being banned on the main road that was here, I was receiving patients being brought dead. And we tried to kind of dig into the reasons behind this. And then we understood there are a whole lot of loopholes behind from the various timelines from the time an emergency crops up to the time the patient actually lands up in the hospital. And we try to go and fix each of those right from the time an emergency comes in, what happens, whom do they call, what happens at the hospital, what happens when the hospital responds back, what are challenges that are happening when the ambulance reaches the patient's residence, when the patient goes back to the hospital. When we try to analyze all this, we found a whole lot of loopholes, and that loopholes is what we try to fix in by this particular project called as BEAST, which stands for Brookfield Emergency and Accident Support Team. This is an app-based two-wheeler ICU emergency response system. The aim of this particular program is to become a national emergency first responder program. How we have designed this is, it is an app which has got three components: a patient app, a paramedic app, and a command center app. The aim is to reach fast, diagnose fast, treat fast, stabilize fast, and then transfer the patient through a conventional ambulance, if required, to a nearby hospital. Thereby, we are able to utilize this golden hour in the most effective manner. As we all know, 80% of the patients do not reach the hospital during this golden hour, and lives are lost because of lack of proper care being initiated. And we flip this around. We said, you don't come to the hospital and the ICU, we will come to your doorstep. So this is a combination of man, machine, medical equipments, medicine, and technology put together. And this two-wheeler is completely loaded with all the ICU infrastructure, right from an intubation kit to a ventilator, to a defibrillator, to a suction machine, to a monitor, to point-of-care diagnostic tests, to all life-saving medications. It has got a cardiac kit, it has got a neuro kit, and it's got a trauma kit. So this with two paramedics who are ICU-trained professionals, who have been done in the ICU. They are the guys who are located in the field. So the command center receives the calls, they divert the calls to the nearest BEAST team that is available in the patient's vicinity, and the whole call is tracked, traced, monitored, both audio, visual monitoring, and then they execute the entire diagnosis, treatment on the spot, be it on the road, be it at their home, or be it in their office. So this is what we have designed. Right now, we have 5 such vehicles. We have bootstrapped this. Vehicle cost is approximately around 20 lakh rupees for us to design this entire ICU on a two-wheeler. Right now, we have 5 such vehicles. The plan going forward is to launch this as a national emergency program. The first phase, we want to launch it across Bengaluru. Second phase, we want to launch it across 10 smart cities in South India. And third phase is to launch it across 50 smart cities across India. The B, which is Brookfield today, we're planning to make this as Bengaluru tomorrow and make it Bharat the day after in this journey of BEAST going forward.
Brookfield to Bangalore to Bharat. That is interesting. And how this project has actually gone? I mean, you started getting patients, and how much you have patients in a year or month?
It's already 3 years in operation. So we have done a proof of concept. We have close to treated 2,500 to 3,000 patients so far. It has been a heartening journey. We have saved quite a few lives. We have treated from the most commonest medical emergencies like hypoglycemia, to hyperglycemias, to poisonings, to acute MIs, to strokes, to road traffic accidents. We have treated a lot of COVID patients during the COVID journey. So those were the kind of a enormous amount of patients that we have dealt with, which has given us real confidence on how we can go about. Right now, we are quite confident about the way that we can manage this, and we have got the right kind of a tech team which is available. We have got some kind of a planning and development that is there, and we are poised to take this to the next level, provided we get the right kind of a funding that we are looking for. So once that is there, we are ready to launch this across Bangalore as a first phase. For a city like Bangalore, we would require 50 vehicles, dividing Bangalore into 5 zones: north, south, east, west, and central, and each zone having 10 vehicles each, and each vehicle covering around 3 to 5 kilometers with 2 kilometers overlap between one and the other vehicle. So that's the plan that we have. And with God's grace, with all the blessings, and with all your good wishes, we hope to make this dream make a reality in the days ahead.
So how has being in academy helped you in all this planning and clarity?
So it was quite interesting to note a whole lot of our doctor friends being a part of this particular academy, right? Yeah. And we did find out that there were quite a number of professionals who had money, but they didn't know where to invest. Various cities, when we have doctor professionals in this platform across various cities, I would probably be welcoming all these doctors to take this up in each of their own cities and launch this. And that is going to be a fantastic opportunity for us to collaborate. I find people with the kind of a skill sets and the kind of a connections that you and Amit have, we should probably be able to get the right kind of people to show interest in this project, because after all, we are talking about a project which is going to save lives, and we are going to talk about, it's definitely got a business sense. When I'm talking about this has got a huge business proposition. I mean, when I talk about the valuation part for it, I've gone through on how it is. We have a revenue models, multiple revenue models in this. So as part of all these things, we have a huge opportunity for investors to come on board and be a part of this great success story that we can hear in the days ahead.
So you are aware that we are also launched Talk Angels, right? In that we are actually starting to cooperate, align with the various fund managers and funding agencies.
Exactly.
We can take it to the next level by that.
Correct. So that's the one that I heard the last time when we were part of the last meeting that I attended to, and I wanted to get in touch with you to know more about that Doc Angels and see how we can pitch in for this particular process.
Absolutely, that will be a great achievement. Right from clinician to hospital owner and entrepreneur, now into an innovation which is going to impact many lives. If there is a student who is coming out, will be amazed and he would be, taken away by whatever you have achieved. What is your one suggestion to the new doctor who has just finished his medicine residency? How should he plan his career? What he has achieved is overwhelming.
Yeah, I would like to take it in two parts, Pranav. One on the professional front. On the professional front, what I feel is they should have a focus. They should have a passion. It should be kind of a complete dedicated effort to dream of something and achieve something as a single-minded goal. And you need to have the right kind of a people to support you in this particular dream, in this particular journey. I'm so very fortunate that Dr. Sangita has been a kind of a shoulder to shoulder. She's been sharing enough of the burden where I don't have to take care of anything else. She bears the brunt of all those day-to-day problems that are there, and I need to just focus on what is it that I've been doing. And that's the way we've been able to successfully run this. So, doctor who's coming out on the professional front, passion, dedication, unwavering dedication towards what he wants to achieve on the professional front. And coming to the entrepreneurship, we as doctors are very, very poor in our finances. We need to make sure that we develop in the skill set that is concerned. But people use us to make money. So rather than people using us to make money, why not we use our own skill sets to make money? After all, making thing that you keep saying in most of the talks that are there. So we need to make sure that we are self-sufficient. We make sure that once you are self-sufficient, that is when you will come rest above and then start talking about how you can contribute towards the society. जब घर में ठीक ठाक नहीं चल रहा है तो ये सब चीज हम बड़ी बड़ी चीज बात करने में शायद we will not be able to achieve those things. So that's precisely these few points that I would like to talk to young budding entrepreneurs, that make sure that you have this concept of you're good at something, you've achieved something. If you can make sure that you're able to get the right kind of a support and use the system that is available now. Gone are the days when there were no support. Now support is available at your fingertips. Use organizations like Doctorpreneur Academy, which is there at every step of your career, which will guide you, handhold you, and take you through to any journey and any dream that you would want to achieve. That's what I would say this young budding doctors who wants to come out.
Great. That was a great answer, because it almost comprises everything, right from dedication to hard work to commitment to entrepreneurial mindset, and finally to the having a proper aim and executing it. And action is very important. So great. Ma'am, how has been your experience of dealing with the hospitals and management of hospitals? What are the challenges you have faced? You want to share something?
Yeah, it has been very challenging. Problems dealing with financial, trying to set everything, not let operations suffer, has been difficult, but we've been able to manage.
Great. Fantastic. You're filling in each other's gap, and properly divided work between two of you. One is a clinician, pure clinician, one is administrator, and combined together, you are a force to reckon with.
Thank you so much, Pranav. Thank you so much for those compliments.
So it has been a great talking to you, and we hope that we will align somewhere to take your dream to next level now. Thank you for joining, and the audience who are viewing this, if you want to understand how Dr. Pradeep Kumar has done all the magnificent things that he has done, setting up a hospital, starting a new venture, starting a startup, then we will put his links in this below this video, so you can contact him. He'll guide you through your life. And if you want to understand how people have taken advantage of that link, you can attend the next webinar and join the community. Thank you, sir. Thank you.